Hello and welcome everyone in another episode of Researcher Celebrity. Today we have pleasure to have Dr. R.C. Dhiman with us as our Researcher Celebrity, and a little brief about Dr. Dhiman. He has done his bachelor's, master's, and PhD in zoology, specialization in entomology from Meerut University, and joined Malaria Research Center, which apparently converted into National Institute of Malaria Research, and retired from there. With this brief introduction, we would like to welcome Dr. Dhiman at the platform by saying thank you very much, sir, for accepting our invite and sharing the journey.
Thank you, Dr. Raja.
So we always start our conversation with our researcher celebrities that how and when you decided to become a researcher.
Dr. Raja, I passed MSc in 1978. During MSc also, I was interested in research because I used to help my supervisors and my mentors, teachers in their thesis. So there I developed interest in doing research. And I came to research just by choice, not by chance. After doing MSc, when I applied for lecturership or research positions, I used to avoid going for interview for the post of lecturers. So I came to research by my choice. And after passing MSc, I went to Zoological Survey of India in 1978. And there I did research. I faced a lot of problems because my supervisor, he assigned the topic, but he left for Commonwealth Institute of Entomology, London. So I faced a lot of challenge. I even got my supervisors recognized for being a supervisor. I did my PhD in ectoparasites of bats. These ectoparasites were ticks, mites, bed bugs, and some flies. So it was a very difficult topic, bioecology of ectoparasites of bats. After doing JRF ship in Zoological Survey of India, I moved to National Institute of Virology, Pune. It is ICMR's institute. So there I started working on sand flies. That time, most of the persons were not working on sand flies, and the institute in Patna was just growing. So there was no research input. So NIV used to do work on sand flies. So though I was in NIV Pune, but we established a field site in Bihar. So I worked on the biology and ecology of sand flies. So after that, I got permanent position in RMRI Patna, that is Rajendra Memorial Research Institute of Medical Sciences, that is specializing on visceral leishmaniasis. So after joining at Patna, I moved to New Delhi in 1991 at the then MRC Malaria Research Center. Now it is National Institute of Malaria Research. It became institute in 2005. So since then I worked on various topics in NIMR, and I superannuated from NIMR in 2017. So that is my journey of research.
So we'll start with the interesting part. Like as you mentioned, not many students have helped their mentors or advisors, supervisors to get their PhDs. You were one of those exceptional ones. So while doing this and facing all the challenges in the research, what was the first thing which made you commit to PhD at that time when you already had a place to work, uh, you know, job to earn, and still you chose to do a PhD?
Yeah, when I was at Zoological Survey of India, our additional director used to ask, he came, what for you came for research? Then I told, sir, I came for doing research. No, no. He told me, no, you did not come for research. You have come for seeking employment. But somehow I was fascinated with research. So I was not thinking that I should get appointment or permanent position that time. So I concentrated on research. So this was my choice.
Mhm.
So because I was very much interested in doing research.
When you started, so from the date of registration to accomplishment or achieving your degree, if you can share the journey of PhD at that time, and then we will come to your students that how that changed over the period of time when you did your PhD and when your last student got the PhD awarded.
As I mentioned, I faced difficulty because sorry, my supervisors were out of station One was a person of fisheries and another was stationed in Saranpur. Two supervisors were there, but unfortunately they were not of the subject. So it was a lot of pressure on me. Then after completing the work, I moved to my guides for going through the contents which I had written, but somehow they liked it. So that time it was not computer. We used to get it typed on. It was very difficult. If there is any error, again you have to remove the paper and use new paper. So it was very difficult in typing stage, and it used to take a lot of, say, 15 to 1 month at least in checking the thesis by supervisor. And that time we used to draw the diagrams with the help of croquet pen, not with the computer. Now it is very easy as compared to those days. It is very easy to even draw diagrams, get figures, and even going through the literature, copying, pasting, a lot of things can be done. So that time it was very complicated and I think uh, hard some work that time.
So, what was the toughest challenge you have faced in your PhD?
The toughest challenge was less input from my supervisors. That was the toughest challenge. Otherwise, I was very much happy in going through the literature, and I corresponded with many persons, celebrities from US, etc. And I used to get guidance from them. So the topic was a bit new. Very few persons were working on that. And you see, nowadays we know the importance of bats and their
Mm-hmm.
ectoparasites. So somehow, so that topic is still, I will say, live today. If somebody
Absolutely.
wants to work, say Nipah, Ebola, and then so many viral diseases are. When I used to go to caves wherein bats roost, I used to get influenza type of symptoms. So today I realized that maybe some viral disease. So I did not know that time. So field work was difficult, and assistance also it was very difficult to go for PhD. Means compilation, printing, typing, drawing figures, adding photographs. All these things were very difficult as compared to today.
So now when you have mentioned about the role and the importance of the technology in the research, how would you suggest for the new generation of researchers that what are the things they should consider before joining a PhD lab or while making their mind that which mentor they should join? What are the qualities in the advisor they should before committing to the lab or to the supervisor? They should consider them very strictly.
Nowadays, I have seen that students choose the guide based on his expertise also.
Mhm.
So sometimes supervisors used to select the student, but nowadays students are also very much wise and they come to the supervisor after seeing his CV, his or her CV.
Mhm.
So I suggest that supervisor should be expert in that field. So it
Mhm.
saves you a lot of time and you become popular the moment you join because your
Mhm.
supervisor is well known. So that's the first advice I will give to students.
Mhm.
And then search literature. Work on the problem which is required by the country. So
Mhm.
here I will suggest our policy makers should also have some topics in mind, like say ICMR. They should have some priority areas, and they should ask the students or researchers, PhD, postdocs only on those topics. And whenever there are permanent positions, so they should seek that type of expertise only. So that will help the students as well as the organization because they don't lose the students who have been trained in a particular topic and this topic is of interest to that organization. So this is my suggestion about this.
So this brings us to next question of PhD, current status of PhD students in India, that what we have seen that after spending 3 to 4 years in a lab, sometimes PhD students get drop out because of so many reasons. And in the worst case scenario, they commit suicide. So what you suggest that what are the things that a PhD student specifically, a researcher going through the tough time should seek help for?
We come to know so many grievances of students. Sometimes the supervisors harass the students. So in the beginning itself, in addition to topic, they should see the credentials of supervisor also. So there should not be any harassment. And if somebody feels harassment, so within 6 months, he should quit. He or she should quit and change the supervisor. Coming to conclusion of say completing the thesis, it is not bit tough. Once you have decided to do PhD, you devote your time. But the main frustration to students, what I feel, it is pitiable that they don't get the permanent positions. Sometimes after doing research, JRF, SRF, postdocs, and they have to go to some unrelated area, wherein all the experience of 10, 15 years is just, I will say, wasted. So this is major frustration in the students. So they should get some permanent positions in the same area, thematic area, wherein they have devoted a lot of time. And say their supervisors are also benefited. They have given a lot of publications, but the students are not benefited. So they should get permanent positions, preferably in those institutes wherein they worked as per the choice of the topic of the organization.
This brings us to another important question about the job market in India about for researchers. As you clearly mentioned that there is some discord between the PhD awardees and the permanent positions. You have served on different levels in administration and in the committees where you have served. What you say that where this discord is coming from, because there are enough what we say, like specifically if we talk about the entomology, Dr. T. Adak always says that the race of entomologists is going to be extinct. There are still so many PhDs who are trained in entomology, either in taxonomy or different parts of entomology. There are open positions which are vacant for a longer time. Why they are not filled, and what are your thoughts that how a student who's getting his or her training currently should aim for say 5 years well advanced, that after their PhD what their landing position will be?
Yeah, here I will suggest the students should decide the area wherein very few workers are working. Means some research questions are there. And if there are tough questions, usually nobody works on that. So in entomology, when we talk, qualitative entomology we do, but quantitative entomology is missing. Still very few persons opt for quantitative epidemiology. And you have to prove your worth. You have to tell to the, say, medical fraternity or they say all the organizations, the importance of entomology. Because when we say control of any disease, you can control, you can treat cases, but treating each and every case is not possible. So vector control, it takes care of complete village. In one stroke, you can save the whole population from the transmission. So still there are some areas, importance of entomologists is still there. So you can see many publications that just because of the introduction of long lasting nets, this much reduction in malaria has been there. One stroke and very much useful, say IRS, you can bring down the outbreaks immediately. So we should work on those topics which are really required. Number one, for the government of India, say, or any government for control of the disease and to which solves some of the outstanding questions. So then their importance of entomology is still there and it will remain.
Absolutely. And this is one thing which people often talk about, that with the global climate change, things are worse, getting worse and worse and worse with every single years, with new diseases either coming or there is re-emergence of the disease which were we thought that we have controlled long back, like chikungunya re-emergence in India. And now Sri Lanka said that they get rid of malaria, but it is coming back. The same case is what United States is also facing, that malaria is now coming back in so many different counties and their states. So when we talk about vector control and we talk about the vector-borne diseases, you have been into the field in the field for more than so many years, so many decades. Your recommendations to the students who are pursuing their PhD and or doing research at postdoctoral level or starting their new lab as an early faculty, what are the things for specifically for vector-borne diseases they should consider and they should make their motto towards it?
Yeah, fortunately, you have picked up the topic of my choice. See, I devoted a lot of time for climate change and vector-borne disease impact assessments. And rather, NIMR was the pioneer when we started this work in the country. And based on this, we could identify the areas which are vulnerable to climate change. The new foci in Himalayan region which are not having malaria, they are likely to have malaria transmission. And by prospective studies, we demonstrated that yes, in Almora, Nainital, the areas which were not reporting malaria, they started reporting malaria. That is because of climate change. And the state of Himachal Pradesh, we are experiencing outbreaks of dengue. Even Japanese encephalitis was also reported. The incidence of scrub typhus is too much in Uttarakhand, Himachal Pradesh, Mizoram, northeastern states, Rajasthan even. So these diseases are flaring up. And in some areas, they were not heard of. So when we started working in Uttarakhand, we used to ask presence of chloroquine in the medical stores. They were not knowing, but the disease was not there. So the new areas are coming in the grip. When we think of elimination, we can control hardcore endemic areas. It is very easy to show the progress. Out of 1,000 cases, you can bring to them 20. But where the 5 or 10 cases are there, it is very difficult. And the new areas which are likely to have the emergence of new foci, they will be difficult. Because usually we don't go for surveillance in those areas. So already we face the shortage of manpower. We always say that the surveillance is not effective, it is not adequate, not strengthened. So what to talk of those areas which are not having disease? But say we have provided maps, district-wise maps we have provided that these are the districts which are likely to have transmission. So we have to concentrate for surveillance in those areas, at least the fringe areas of transmission. The disease in Uttarakhand, like Haridwar district is endemic, but the contiguous another district, which is not reporting malaria. So they are also vulnerable. So we have to devise methodology, provide manpower so that surveillance can be undertaken at least quarterly, which are not reporting malaria. So it will be a better, I will say, early warning type of work so that we are better prepared. So that is one thing. And many diseases, script types, very few persons are working. It is found in Rajasthan, which is dry zone. It is found in hilly areas of Himachal Pradesh and Uttarakhand also. But depends which months are suitable for transmission in Rajasthan and which are the months suitable for transmission in Uttarakhand. So then we have to come to some preventive measures and then vector control. Nothing is being done as on today, I will say. Even these diseases are not under surveillance for national program. National program has mainly 6 diseases, when script typhus is not at all. No KFD, even leptospirosis is not there. And Dr. Raja, I worked on KFD also because this was a
Mhm.
question in my mind when Dr. Rajagopalan used to tell about his work. So I started working on KFD also. I visited that area and I could study the ecology. So we did 2 type of works there. Climatic variables which are related with the upsurge or transmission of KFD. So we
Mhm.
could come to know that by the time, say it has to be a forest, heavy rainfall should be there. So during rainy season, the tick vector breeds. When the rain ceases, then only the transmission starts. So the quantum of rain, based on the quantum of rain, we can come to conclusion that if rains are too much, they are ceasing in the month of November or December, it will be delayed. There will be no outbreak. But if rains are stopping in the month of November itself, so the ticks come out and transmission starts. So another thing that we did, some bioclimatic factors we studied. That based on with these bioclimatic factors, we can predict that this is the area wherein KFD can go in future. Otherwise, most of the areas, there is no suitability for expansion of the zone of national forest disease. So there are many areas, but the only thing is they have to find out, students have to find out the areas wherein very few persons are working.
This brings us to
Repetition should
the
not be there.
yes.
Pardon?
Yeah, yes, please. You
Now, please
continue.
carry on.
So
You
this
can.
brings us to the next point because you clearly pointed out very important question that there is always this area, the niche where a student can aim towards for a longer run. But now comes the point of funding sources. Because if there is not enough funding resources, you have served in so many committees where the bench decides that which project should be funded, whereas which should be dropped. And when talking about the disease like KFD, scrub typhus, what are the percentage that the government is ready to fund them specifically for surveillance only?
I will say there is no scarcity of funds
Mm-hmm.
because I have seen in many committees, and particularly say DST, DBT, ICMR, Ministry of Environment, Forest and Climate Change. There are so many organizations which are providing funds, and even NGOs are also there. So even we are short of expertise, the persons who wants to work. So DST in my presence itself, so when it was new, we were growing. So DST opened a climate change human health folio, and
Okay.
we started working as gradually 6 PIs, 10 PIs, 20, 30, 70, hundreds. So number of PIs increasing. The same way, ICMR also started global environmental change and health. So in the beginning, only 4 partners were there. Gradually, it is growing. So most people are going through this topic that it is very much say hot topic, climate change and human health. So many persons are coming. Vector-borne disease, so many now researchers are there who are having interest in this topic. So still I feel, and not only that I did not feel the shortage of funding, but still I find lot of funding is there. If your topic is pertinent, innovative, and really it solves the outstanding question.
I think this is the time where I should tell all the new faculties that, as per Dr. Dhiman, there are not scarcity of any funding. So if you are facing funding issues, so you have to check your project that what India needs, what are the areas where you can fit in or tap in better by just modifying a little bit of your project. And this is something which is very important because running and setting up a lab at early career stage is very important, not only for publication, but to develop your own niche also. Speaking of the niches, Dr. Dhiman, when you started working in the area of global climate change, when not many people in India were doing, and you are one of those pioneers who have done this, now how do you suggest or guide the next generation of vector biologist or entomologist that using the knowledge developed by you and the other folks in the fundamental work is done, now how to capitalize on that?
Very good question. Say, based on our work, we could set up Center of Excellence for Climate Change and Vector-borne disease. So there was the time DST funded it. ICMR was also willing. So sometimes lot of opportunities are there. So we accepted funding from DST. So the only thing based on this work, ultimately its fruits should go to the community.
Yes.
So we know the vulnerable areas, but what that vulnerable community should do to prevent the adverse impacts due to climate change. So based on this so much sensitization, Government of India set up one special program, National Program on Climate Change and Human Health.
Mhm.
On the analogy of NCVBDC, Vector-borne
Mhm.
Disease Control Program, now we have National Program on Climate Change and Human Health. So as per their plan, they have to have state nodal officers, district nodal officers. All this workforce needs to be trained. So
Mhm.
number one, imparting training to the new person so the district level expertise is available. And then coming to community, devising training modules, media formats, so many formats, say through video, through pamphlet, charts, and GF, all these exercises are required for going to the community in different languages. So these are the things wherein community can be benefited by all the research which has been undertaken so far. So many areas are very important. Vector-borne disease, air pollution, then heat waves. So in heat wave also they have reached to the community. Action plans have been developed for heat wave mortality, how to prevent from the heat wave mortality. Same way, how to prevent from the adverse impacts of climate change due to, say, vector-borne disease, say malaria, dengue. KFD, scrub typhus. These are the major issues. Kalajar is towards elimination. Almost we have declared elimination. Uh, JE, the confined to limited area. But dengue and malaria, KFD and scrub typhus, these are still very important and we should reach to the community.
So, yes, sir, when you pointed out a very important part of vector-borne diseases, the community engagement. So, how the extension and outreach in India have, how effective it has been proved in the past, and what you suggest to the new generation of entomologists or public health workers to use extension and outreach?
Actually, when we say climate change, this aspect is, I will say, in infancy. Still, it has not reached to the community. But I have seen in malaria or say through national program. So I am involved in some of the programs. So I see lot of IC material is there. And through even e-learning is also has been advocated. Now e-learning of all the health cadres right from ASHA to state program officers. So e-learning modules, plenty of literature is available for vector-borne disease. So the persons, if they want to go through, they should see the website. Similarly, on the analogy of NCVBDC, for climate change also, training modules, learning modules at different levels, say for ASHA, for medical officer, for policymakers. So the same type of modules will be available after some time. It will take some time. So this is, I will say, the area wherein one should concentrate.
So, speaking of our communities, especially in case of rural parts of India, where people are not still, at least some of the generations are not very well equipped with the education where they can go and read that. Now, in this case, when government has trained workforce which can go there and then educate them about the vector-borne diseases, about the things, the parameters they should always be surveillant, pay more attention towards, like being the larvae in the water, as simple as that. Because a person who is trained as an entomologist knows that mosquito larvae breeds in the water. But for a person who is not of this field, probably what they call that as worm in the water. They don't even know that they are actually harboring the mosquitoes in there. So when you have worked in the field and you might have noticed this plenty of times, what are the things which we as in country, as in public health workers, should be more sympathetic towards them, because in some of the areas the water supply is so bad that they don't have any other option but to store water for weeks and months in some cases.
No, you are right. But say we cannot send each and every person to all the villages. It is very difficult. So we have to create a force of say ambassadors. And usually these ambassadors are nowadays an ASHA.
Mhm.
ASHA is available in each and every village nowadays. So that is the point wherein they are directly engaged with the community. And from ASHA onwards, the multi-purpose health workers are there. So these forces can educate them. And it is their duty to provide education and to at least show the breeding habitats and the mosquitoes. I will share you one example. Once I went to Bikaner, then the DMO was telling that the community does not believe that these are the larvae of mosquitoes because they say
Mhm.
mosquito flies, but you are saying
Mhm.
wrong. The larvae, this is different creature.
Yes.
Then that person took the larvae, put in a jar, plastic jar, transparent, and put one mesh over it. And he came after 8 days and he demonstrated. Now there are mosquitoes in the same jar. So this is the way how they can educate to the community. So they can, then they will understand, yes, these are the larvae and these are mosquitoes babies. So they
Mhm.
will understand that. So we have to devise our say methodology to educate the community. We have to come to their level. We should not be say scientific or say entomologists. We have to
Mhm.
come closer to the community and we have to teach in their language so that they understand it. And once you teach to 2 or 3 persons in a village, and this will spread, they will learn it.
Absolutely. And so this brings us to another level of difficulties and challenges which a researcher face in their lifetime. So say communicating their science to the person who's not an expert in the field. And this brings to the basic understanding of a general audience that scientists are not very good as communicators. They lack that discord because they don't know how to simplify most of the things. So the challenges which you have faced, you shared one of that. And now how you suggest or guide the next generation of the researchers that how they should prepare themselves for making or simplifying the science to the general audience.
Yeah, usually very few researchers write for general audience. They write for research papers. They select the journals based on their impact factor. So they see the impact in the scientific community, but not the impact of research in the community for which they are supposed to work. So I will say very few persons, and it is a say flair. Once they start visiting community, they have field work, then they will try to come to their standards, and then they will understand that we have to be very simple. So I have seen, says in Cambodia, we say talking the same language and even
Mm-hmm.
wearing the same type of clothes, then only you are close to the community. These two aspects I learned from there. So otherwise they will feel this person is say a babu from urban area. So you have to
Mm-hmm.
come closer to their say way of talking, way of sitting, eating together. That is why our politicians they eat with the say villagers. They show that we are very close. So scientists also, if they start writing for the community, they have to come to their level. They have to visit, they have to undertake field work, and then they will understand. Say, when we go to village, the people ask, what for you have come? We used to tell, we have come for this purpose. If there is malaria, we will tell you. So then they will ask you, will you communicate to us? Then this is a question in the mind of scientists. We communicate in scientific publications, but the community from where we get the material, we get the data, we don't communicate to them. So it is, I will say, uh, all the researchers should think that at least they should communicate their findings, translated findings to that community wherein they work. So please, this is a very important point, I think.
Absolutely. And this brings us to the next thing that the outreach and the extension, how they say, is a two-way method. You go and collect the samples. Now the community there has so much faith and trust in you because when we talk about mosquito collections or any other vector collections, you are supposed to take permission from the people to use their households as your study sites. And this is the least we can do is to tell them back that whatever we found were positive or negative. Because sometimes in the studies, in the epidemiological studies, they only go and collect samples from a positive reported case because they want to know that if the mosquitoes are positive for the virus or for the parasite, and if we can tell them and establish this reputation that whenever a researcher walks in to these communities, they always welcome it with open arms, and then they are also more contributing in this because in current age, what we have seen that the different parallel parallel to Ayurveda. There are so many medicines value system in India where people, the traditional knowledge is coming more out and out into the main front where the researchers are just going to perform experiments and prove some of those ancient medicines used there for ages. Now they are using those same by doing the scientific experiments and proving that okay, this thing works better than the other things what we are using without the side effects. So for this, what you have experienced and what will you suggest to the new generation?
Actually, there are three types of say, ethical consents which are required, in my opinion. We usually take consent for taking biological sample,
Mhm.
and there we write, we will treat you free. If there's any adverse reaction, we will take care of it. If you have any question, you can contact this person. So for biological samples, ethics consent is okay. Gradually, it came for sociological questionnaires. For questionnaires, in the beginning, there was no criteria of getting consent, but nowadays there is consent for even interacting with the community and whatever information we are getting. Third consent should be for collecting mosquitoes from their
Mhm.
houses. So once we should write that after getting this, The results will be shared with you, and even the overall findings will be shared with you. So if these three types of things are there, then the community will be benefited.
Absolutely. So, sir, we talked about the different journey at different levels. Now, the most important topic about the research, the stress which it brings, either it is for submission of a new grant or rejection of a manuscript from multiple places. The stress, I'm sure that most of the researchers always bear in their head how they should deal with it, especially like when you are more mature in the field, you know how to handle it. But for the newcomers, for the PhD student, postdocs, or early faculties, it is tough to handle. So, your word of wisdom, how they should manage the stress which comes with the failed experiments or rejections.
You are right. A new person or newcomer researchers will always feel bad if his or her paper is rejected. But it is the duty of supervisor to share his experience and encourage them that no, this is not, you will get better advice. So based on rejections, we get lot of positive comments also, wherein we can improve the manuscript. Say we published one paper, district level mapping of vectors of malaria in India. This paper took 1.5 years for revision, revision, and revision. So, but they were all better suggestions. So we go on modifying the text, but the ultimate outcome was very good. So this is the way then we felt happy that at this district level mapping of vectors of malaria in India is available. So one can
Mhm.
find and refer this. So they said before DDT era, after DDT era, after a slice time of 10 years, what the situation. So we know everything. How the vectors say no areas are coming in the fold of that distribution of that vector. So it always helps, I say. Criticism is very good. So rejection, I will say very good. You get improvement and you can improve your paper. So the supervisors have to handhold the students. So they should
Mhm.
encourage them.
Absolutely. And I think this is the thing which all the supervisors should be more sympathetic to their students also. As Dr.
Yes.
Dhiman just mentioned about it, that all the supervisors have been student at some point of time. And with this new technology coming, the students sometimes are there. Dr. Dhiman has done this 3, 4 decades ago when he was supporting his mentors and advisors for their thesis and research part. Now also students are coming with the information, with the technology that they are so trained in that they still do teach their mentors and advisors how to use either it is software or so many other things. So it is always both ways. The mentor and mentee relation always is there, was there, and will always be there. So you should be more sympathetic towards your student and to take care of them. So this brings us to another important question, sir. How and like why we don't see the responsibility which it should be for a student whenever a PhD student or a postdoc student joins the lab. What we have seen is that like on the name of professionalism, the PIs don't take enough of the responsibility of the student that they are responsible for their success if they are the PhD students, then to get their PhD within time and with all the publications which is required. In terms of postdocs, they should be feeling responsible when after their postdoctoral training, they should be placed in a getting jobs or in if they want to be an entrepreneur, then they should make their path to that.
Yeah, it is the, I think, foremost duty of the supervisor. Once they accept the students, they should devote time. But depends on how much time one should devote. Maybe 50%, 10%, 20%. So postdocs are usually, I will say, established researchers. So they have to further going into the deep into the topic with the help of supervisor. So postdocs don't require that much hand holding as
Mhm.
compared to JRF and SRF. But I will cite you one example. There was one director. He did not see the any draft of the paper. He asked to submit the annual report. He will not check it. He will say, okay, go ahead with printing. So when the print comes, if there are errors, the student will feel ashamed and he will rectify immediately. So that supervisor was not devoting time for correction of each and everything. So
Mhm.
once you give this type of message, the candidates will feel more responsible. So at least at the stage of postdoc, na, they should experience a 95% of the responsibility.
Yes.
And Dr. Raja, I have seen in other countries, here our students, they take lot of time, and I will say they will be under guidance for a longer time. But in other countries, once you are registered as a student, in all the meetings, they are asked to sit and prepare the minutes of the meeting. And
Mhm.
here, our students, it will take lot of time, 10-15 years, then they will start writing minutes of the meeting. And once they are student, immediately they learn it.
That's so
And they are
true.
in the company of experts. So
Yeah.
these are things they should learn, say writing skill and speaking skills.
Mhm.
These are additional aspects when doing research. So unless you have these communication skills and speaking in writing, one cannot come up easily. Otherwise, he will remain hidden. It will take longer time for them to come up.
Absolutely. Yes, sir. So this is something which we always say that the soft skills are very supportive in your communications, either to your own peers or to the general audience. So th- this was the conversation with Dr. Dhiman, where we have talked about the researchers, like starting from the PhD to the early faculty, and obviously to more mature version of researchers. I hope the audience can be benefited out of it. And if you want to write to Dr. Dhiman, you can find him. He is all over the web for your any specific guidance or question. If you want Empowering Sense Foundation to put you in contact with our researcher celebrities, we are there to help you. One thing which we always say is that just go and enjoy your research. With this, we will say thank you, Dr. Dhiman, for sharing and guiding the new generation of researchers. And we look forward. Thank you, sir.
Thank you, Dr. Raja. Can I add two, three things?
Yes, please.
Uh, Say without the support of supervisors, you see, I liked working on the new areas. Say
Mhm.
remote sensing. Nobody was working in the country. That time, our mentor, Dr. VP Sharma, he advised me to work on this topic. So this was a very difficult topic. When we went to Indian Institute of Remote Sensing for training, people used to laugh that what are you going to do with remote sensing? Are you searching mosquitoes? So it was a pressure on us how to relate remote sensing with malaria. Then came climate change. In climate change, also very few persons were working. But when we started searching literature, we found that this climate word is very old in India.
Mhm.
In 1927, there are books on climate and malaria.
Mhm.
And even early warning of outbreaks was being done in Punjab for 10
Mhm.
years from 1947 onwards. So searching literature, accepting responsibility, identifying novel topics, it gives a lot of pleasure. So one
Yes.
should not worry that always somebody will help you, somebody will help you. You have to help yourself also because learning is very interesting aspect.
And this is
So thank
something which all the researchers should thrive for.
thank you. Thank you very much.
Absolutely. All the audience, please stay tuned for another episode of Researcher Celebrity. Once again, we'll thank Dr. Dhiman for guiding us. And thank you very much, sir.
Thank you, Dr. Raja.